Welcome to the Coffee and Counseling Podcast, where two licensed psychotherapists give you their unfiltered opinions on mental health, wellness, life, and everything in between. It's real, raw, and ready to challenge what you think you know. Get ready for some tough love. Before we begin, just a brief disclaimer, this podcast is for educational and informational purposes only and does not take the place of therapy. We hope you enjoy today's session.
Hello, everyone, and welcome to today's session of Coffee and Counseling, where we don't spill the tea, but the coffee will be piping hot, where we talk about all things counseling. We're your hosts, Rachel Steinhardt
and Stephanie Van Schaick, and today we're pulling back the curtain on something a lot of people wonder about. What actually happens in a therapy session? What should it look like? What does it look like? How you're supposed to feel afterwards? All of that. So grab your coffee and let's get into it. Rachel, want to start us off with your high and low for this week?
Yes, the kids are in camp. It's a high. Oh, it is such a high. So thank the Lord for that. Mm-hmm. And I guess now the low is I don't have an excuse to not get more things done.
I love it. I remember, I think you just posted on your Instagram a short about, or maybe it's on Instagram, it's called A Reel. About motivation. Yeah. And that is maybe untimely right now. It's just what 100%. You need.
I was just like, they've just been home for over a week straight. I don't have motivation. I have motivation to go to sleep. I have motivation to go to Fiji. That's what I have motivation to do. I don't have motivation right now. And then I'm like, you know what? Like, what would you tell your followers, your clients? And by the way, guys, we really do this. Like when I call it therapizing myself. I don't know if that's what everyone else calls it, but
me too.
I always tell clients, pretend when I'm not there, that when you're not sure what to do, like, what would I tell you? And I have a lot of clients who tell me they have this part of their brain that goes, what would Rachel say? Or what would Rachel do? Which is hysterical. But I do it to myself. I'm like, okay, like, you're not motivated. You want to go right back to bed. What would Rachel say? Like,
I love that.
And then I try to do it. And then I was like, you know what? I feel like other people might benefit from this message. So I made a reel about it. But
that's so funny. My clients have told me that as well. And then normally they're annoyed by it. They're like, yeah, I wanted to engage in this behavior, but then I thought about what you would say. And I heard your annoying voice in there. And I'm like, you're welcome.
Yeah, it's just we love that. Yeah. We love that we're haunting you guys.
Yes, because you know that hopefully whenever we're in a therapy session, obviously we have your best interest at heart, and our voice can maybe help negate whatever negative voices might be in your head, right? Or that you're struggling
your
with.
Own like wise mind can do it without our voices needing to be there. Ours, you're just borrowing ours.
Yeah, when you're a little confused, you're struggling in that moment, it could be a helpful tool. It's not the be all and end all for sure. So my high and low for this week, I would start off, I guess, with my low because it might impact our recording a little bit. My throat is hurting and I'm really hoping I'm not getting sick. I'm hopeful, but I'm coughing a little bit and it's hurting a little bit. So I'm drinking tea with honey. I must confess it's not coffee today. I apologize, everyone, but it'll have to do. And my high for this week, I would have to say something that happened earlier this morning. So I've been trying to prioritize getting outside, and in the Florida heat, the only time you really want to do that is in the morning. So I went for a walk, and there's a bunch of trails near me, and it was really nice. I was trying to be very intentional, and I have to give a little bit of a background story to understand this story. And so about a week ago, there was a black bear spotted in this community, and it was like going between
in Florida.
In Florida, so where I am, there's a huge black bear population, but they're in because there's so much forest around here. It's not near us, really. Well, I guess obviously there is. I'd never seen one before until we saw pictures within the community. So it was a black bear, and yeah, I don't have Facebook. It was all over Facebook, and my mom sent it to me, and my neighbors were sending it to me. So Facebook saves lives now that I was like, oh goodness. it was garbage day too. So I think that he was scouring around for their garbage probably.
Oh my
But
goodness.
regardless, that was about a week ago. So on my walk, I, of course, was scanning around, making sure I wasn't about to get mauled by a bear or something, because that would really suck. So as I was panning around, I saw in the distance, and not too far, it's gated, but there were a bunch of cows grazing, and it was just like such a nice, and obviously you know how I am with animals, so Rachel's probably like rolling her eyes big time. But I was like, "Hi, cows," and I greeted them, and I walked back, and then they all saw me, and they just like froze. But it was so nice to start the morning with nature, seeing cows, something that I haven't really seen before, like on my walk. So that was a nice moment. So I'd say that would be a high for me. And
Such a
hopefully no.
nice person. I adore you.
Thank you. Thank you. So let's get into the topic for today. So the reason why we really wanted to cover this is, one, we've had a couple people ask about if we could cover this. Like, what does therapy actually look like? And how do I know if it's working? How do I know if I'm doing it right? How do I know if my therapist is doing it right? And the thing is that because therapy is private and confidential, we can't go in and be a fly on a wall for another person's session. So it makes it really hard to understand and know exactly what a session's supposed to look like. And that could be causing people concern. Like, is it right? Am I doing it right? And our only real reference, with the exception if you've been in maybe group therapy, that you've been able to witness how it works with other people, that the biggest examples we have are in pop culture or in media. And Rachel, you could probably back me up on this, I'm sure, that you never want to watch a movie or a show with the therapist when there's therapy being happening in the show or the movie, because they're always doing it wrong. And sometimes there's some good tidbits that I'm like, oh, I kind of like that line or whatever, but it's completely boundaryless. It's all stuff that no one would ever say, or all of a sudden this complete epiphany happens, and it's like, well, where did that even come from? It's strange. And I wish I could think of an example, but I've just had way too many of them. Is that something? I think it's a therapy wide.
It's funny.
thing.
I actually never thought about it that way. I actually really love watching anything that consists of therapy, because I guess I like comparing it to the real world and thinking like, how accurate is this? Like, depending on the type of movie or show, is this something I can learn from? Is this completely off? So I guess for me, it would depend. I do find it really funny when they say like the most ridiculous things. Like, I know you're obsessed with Lorelai Gilmore. So she's like a character in a movie. Oh my gosh. Because I Said So. I love this movie so much. I don't know if you've ever seen it.
I don't think so.
But she's talking to this like same client for like 15 years. And he's always there at the same time, the same day, every single week of his life, talking about the same thing, about how, and trigger warning, I don't mean to be insensitive to anyone, but the entire time he's just talking about how he's going to take his own life for over 10 years. And towards the end of the movie, she was like having a family emergency, and she said to him, like, I need to run. And he was like, you can't cancel on me. He starts losing his mind. But it's a comedy, just for me to give you guys some background. This is a comedy.
I have seen this now that you're saying this.
And at one point, while he's losing his mind, she like throws the door open and goes, for 15 years, you've been telling me you want to like jump out the window. And then she like points to the window and she goes, well, there you go. And I was like, yeah.
It would be so inappropriate.
Potentially go to jail. But, so I would say it depends, but I definitely know what you're talking about.
Yeah. And, some of it, I'm going to confess, one of my favorite my favorite breathing technique that I personally use, I learned from a therapy session in a horror movie. I don't remember what horror movie it was, but it was like this weird, eerie thing. And this guy or this woman, I don't remember, kept going into a therapy session, and the therapist had introduced a breathing technique, and it's called the 5-7-8 technique. And I'm sure it's somewhere. Well, I know I've done a video on YouTube before about it, but it is my favorite breathing technique. So you can certainly learn things from there, but it's not always the way that it actually looks. And there could be
Especially
some
if you don't have that education to decipher what's accurate and what's not. It's a very dangerous way to gain information. Definitely don't use that as a reference at all.
Right, exactly. There's some things that are pretty, yes, that's probably pretty accurate, but most things, especially what's actually being said, is not. And a lot of people come into therapy not really knowing what to expect from therapy or what therapy is. They might be looking for straight up fix my problems, give me whatever I'm supposed to be doing, and I'll be done with it. Or that by the end of today's session, I'm going to be magically fixed and I'm not going to need you anymore. I just need help with this problem. Or even coming in and expecting therapy to just be something that you can vent all the time and get no feedback, nothing else from it other than just venting. So those are some of the misunderstandings and misconceptions that I hear when people are coming into therapy for the first time.
Yeah. And by the way, in regards to the just venting thing, unfortunately, we have had clients that have come to us after previously being in therapy with the complaint that their past therapists weren't really saying anything, weren't really doing anything, and that they just felt like they were venting. If you feel like that's happening in your sessions, that's not right. That should not be happening. If you feel like there's no productive reflection or, awareness, insight, psychoeducation, I mean, I can go on. If nothing is happening in your sessions other than you venting, people could call that a style from today until tomorrow. I'm sorry, that's not therapy, and you deserve better. So I'm just going to put that out there right now. So let's get into what the first session might look like. So the first session is like a two-way interview. You're getting to know the client is getting to know you, but depending on both the client and the clinician, this can look very different in a multitude of ways. Sometimes you have a clinician who really wants to allow the client to feel comfortable by just giving them the space to say or not say whatever they want. Sometimes you have a clinician who goes through an intake, which is the document of questions, just getting to know more about them, their past, whatever they feel comfortable sharing. And they go through an intake together while they also explain to the client what they can expect from their particular style, their particular modalities, what type of treatment they're planning on giving, or what some of the work they hope to do, what are some of the goals. Definitely establishing goals is a big one. But a lot of this depends also on the client. Sometimes you have court-ordered clients who are angry, who don't want to be there, who feel like they're not supposed to be there, whatever it is. You have kids whose parents or school or whatever are forcing them to be there. And Steph and I know what it's like to sit with somebody younger or a teenager that just wants to sit there and stare at you. And you're like, all right, well, I can do this all day. Go for it.
Doesn't want to be there, right?
Yeah, and you could be sitting there in total silence. And it really depends. I've had clients where we're both truly like testing the waters and feeling it out. I've had clients come in and in the first 3 minutes, they're just bawling their eyes out and letting it out and finally feel a place they can be safe and let their guard down and just feel like they can say what they need to say without judgment. So the first session can truly look different for different people. That being said, you can expect to ask questions, get questions answered, share what you feel comfortable sharing, and get to know a little bit more about if you're continuing therapy with this therapist, what might that look like? What are the goals that you have, and how the therapist plans on getting you to those goals. Now, as I say that, when we're in grad school, you're writing out these like very extensive treatment plans, same thing that we do when we're working in hospital settings and sometimes partial hospital, sometimes outpatient, definitely partial hospital. There are settings where you have this like written out treatment plan, intense paper form that is really only done, honestly, I'm sorry, I'm going to say it, for insurance. That's the reality. Now, if you want a written out treatment plan and you talk about that with your therapist may very well be willing to do that for you. But the reality is, in talk therapy in private practice, that doesn't really happen. It just you talk about the goals and you talk about the plans and you talk about what you hope to work on. You know, if you're, for example, with me and with Steph, we both assign homework. We talk about what some of those homeworks might look like or what our expectations are, what we're hoping to see throughout the weeks. But there isn't this like exact timeline, exact treatment plan. It changes as things come up. It changes as you get to know each other and you adapt. So, you know, I think sometimes people come in and they want this like tangible, concrete, tell me what's going to happen exactly every week, every time, and like show me this diagram of how I'm going to either recover or feel better or fix this problem. And I mean, therapists, feel free to disagree with me, but it doesn't really happen that way. It doesn't really happen that way. At least not in my experience. And I have worked in those, I have worked in the more intense care units and higher levels of care. And it just, even with the treatment plans, it doesn't end up working that way. That's the reality. It's really paperwork for insurance. So that's just something to keep in mind as well.
Yeah, I know some people in private practice who do the formal treatment plans, and perhaps it's something that based on their style, it works out really well for them.
Sure.
That's again just goes very different from therapist to therapist. I don't really see how with my style that could be truly helpful. I mean, I always have an idea. I always am making recommendations to myself as to what I'm supposed to be, what I should be doing, and prompting for and interventions that I should need for the next session and from session to session for our longer term goals. But because humans are just so dynamic and there's so many things going on that sometimes we need to work on one goal first before something else. And for another client, if dealing with the exact same thing, maybe we actually need to tackle the thing that we did latter for the first client with like first and foremost. Perhaps if we're dealing with anxiety, we need to be making sure that we are giving anxiety tools. And some people might say, let's throw you in and then we'll give you the anxiety tools. And that is, it could be different person to person depending on what works best for them. It depends on the style for the therapist. So just another way that it could vary so greatly.
Yeah. And I just, by the way, I really want to clarify. I think treatment plans are wonderful. This is not to say anything bad about them. If somebody's writing you a treatment plan, or if you are interested in one, there's absolutely nothing wrong with that. You're entitled to that. And for whichever therapists do that, kudos to you. That's great. All I'm saying is it's not always so simple. Sometimes it's a little bit more complicated when you have someone, like Steph said, that is, you know, I mean, we're all very dynamic humans, but some people come with more simple things that they want to overcome, and some cases are a lot more complicated. So just depending on the situation, sometimes writing out that treatment plan, you know, it might feel reassuring in the moment that you can see where the path is going on paper, but it doesn't always follow that path, I guess is my point.
Yeah, sure. And that makes so much sense. And I think it's really important for people to understand how it could work in people's favors and how it can be something that can be helpful, but it's not always necessary. And like you said, it's a lot of times really for insurance. And as long as it's living, breathing, that's important, because sometimes treatment plans could get very rigid and it can also set you up to feeling like a failure if you don't get to your goal by that person.
Right. Exactly.
Right. So drawbacks
that's one of the reasons I know for Steph and I that we, you know, we try not to stick to something like that, because it's kind of like saying, you're talking to someone who's grieving, we expect you to be over it by month 6. Like, you can't do that, And
By
so
March 8th, you're over your trauma, okay? Get over
exactly.
it.
And so, again, with the goal setting, we're hoping that we're hitting certain markers. We're seeing some level of improvement, but to be very specific with what those are sometimes can be damaging.
Totally.
The last thing I really want to bring into the space of the first session is for you to not feel pressure. I always tell clients in the first session, I would rather you tell me you're not ready to talk about something or that you don't want to talk about something versus being dishonest. And unfortunately, in a lot of the work Steph and I have done, we have a lot of experience with clients being dishonest about saying no to traumas that they've been through. Like, if we're asking and they're saying, yeah, no, I've never experienced that, or I don't even know what you're talking about, or saying that they don't self-harm when they do self-harm, saying that they don't use certain behaviors when they do use certain behaviors. This is so dangerous, both for the clinician who is responsible for your safety and your mental well-being, and for you. Mm-hmm. So when you're going into that first session, if you need to pin something on the wall and say you're not ready to get into it, that's fine. Please, please, please try to stay as honest as you can so that the clinician can give you, the best that the clinician can give you in terms of their knowledge and their support and their treatment plan and everything, because they can only do that based off of what you're saying.
Mm-hmm. True. And to add on to that, it's really important that you guys understand and know this and be graceful with yourself if you ever have been dishonest or misled a therapist, that a lot of times that could be part of the disorder. Like, eating disorders, it's a really, really big thing for. It's trying to protect you in some way. For a trauma, it could be a protective mechanism as well. There's different disorders or issues that you might not feel safe disclosing. And all we're saying is, please you can say, I'm not ready to discuss it, and that's totally okay.
Right.
And that's something that the therapist will work through with you at the point that it is going to be appropriate.
Right.
But it's just important to do your best to be honest. And if you are struggling with that because of something you're going through, be honest about that too. So let's talk about what does an ongoing talk therapy session actually and typically looks like. I hate to say this again, but it depends. It's so dependent on the therapist, the issues you're dealing with, and also where you are in treatment. So I could tell you that I have, amongst all my clients that I've had, that I do have, and I'm sure that I'll have in the future, and Rachel, I'm sure you have the same, that one session to the next isn't always looking the same, and one client to a next isn't always looking the same, and one client at the beginning of treatment might not look like the same client at the end of treatment. There's so many different dynamics and factors that go into it. And if you are doing a structured type of treatment, that's going to look different too. So for an example, one of the more structured treatments that I personally provide is cognitive processing therapy, and this is something helpful for trauma. And this is a very incredibly structured session. These are incredibly structured sessions where we have to discuss something. We have a lot of homework. We have things that we're learning, how we're going to apply it, and how we are changing our thought patterns and our beliefs. And that is incredibly structured. But most of the times when I'm not dealing with that type of therapy, it is a much more free-flowing session. Like Rachel said, one thing that we are more structured with is making sure that you know how to get from one session to the other and actually be applying whatever it is that we're talking about. So that's usually in the form of homework, some sort of goal that is agreed upon in session, so that you know how to incorporate what you're learning and experiencing in therapy outside of therapy. But beyond that, sometimes we start off and we know we have an agenda, that's something we didn't get to talk about last week, or you did something that you were really nervous about, and we're like, okay, how did the tools work? We're checking in on that. maybe we have an agenda and then you come in and something just happened that was pretty crazy or upsetting to you or really exciting to you. And then sometimes that takes over the session. So it's a relationship. That's really important to know. It's not like any other relationship. It's not a romantic relationship. It's not a friendship. It's not a familial relationship. But it's not a robotic relationship either. So it is about that type of connection and being able to process the different things that are going on with you. And sometimes it's a lot of you talking and a lot of therapists listening. But that's where we talked about a little bit before. And maybe, Rachel, you want to touch in on this a little bit more. I know you had a lot to say about this, that doesn't – sometimes you do vent in therapy, and that's okay, but it can't be the only thing, and it shouldn't be the majority thing that you do. It's important that your therapist gently guide the conversation when necessary, help you make connections, reframe, reflect things back, help maybe get you to a place that could be helpful for you. Do you have anything that you want to add to that? I know that you had a lot that you wanted.
Yeah. So first of all, with venting, I always say there is a point to venting that becomes unhealthy. When you're just talking in circles, any of my clients, if you're listening, sorry guys, you've heard this so many times, but I call it the merry-go-round. It's like you go on a merry-go-round and like, it's cute. You go around, it's nice, it feels good. You go around, it's cute. You like the ride, you like the scene, you like the up and down. When you're going on the merry-go-round for the 45th time, you need to get off. And that is really what venting is. And so if you're solely venting about something and nothing is being done with the venting, that's not healthy. Mm-hmm. That's why you find people like venting to their best friend about something that bothered them. The same story for weeks, for months, for years, because there's no productive work being done there. And they're just reliving this thing that they can't get over. First of all, I really want to make, that point about venting and how it can be such a healthy thing, but done inappropriately and to no end can actually be very harmful. The other piece I really want to bring up is a topic I really think that I have not really ever heard therapists talk about. And I definitely know clients inquire about this. I've talked to Steph about this, but I think there's an unspoken space in therapy where you find yourself working with someone that isn't necessarily responding in the way that's going to get the client to certain realizations or to certain understandings. Like when as therapists, we're trying to guide a conversation. We're trying to get you to answer your own questions. We're trying to get you to, use your own tools and your own internal light bulbs to have these clear moments and have these aha moments, right? And a lot of the time, I think when we're being trained in therapy, or we see like examples of how a conversation would go, it's very ideal. It's like, oh, well, you ask this open-ended question and then they give you this like, wow, I never thought about it that way. And they give you this incredible answer that's so insightful. And then you work off that answer and then they work off that response. And I want to tell you guys something, it doesn't always work like that in sessions. Sometimes you're with somebody and based off of their willingness or motivation to be in that session and do the work, whether it's the fact that they have gone through really horrendous situations in their life and they don't really know any better, whether they're trauma victims, abuse victims, they grew up in really unhealthy homes, were involved in really unhealthy relationships. It could even be like the only work you've ever known is in a really unhealthy work environment. So it could be a lot of different things. Sometimes we have these conversations or we bring in psychoeducation where we educate you on red flags and green flags and yellow flags. And we talk about what abuse might look like. And we talk about things that may sound concerning. And somewhere along that line, there is reflection and education and something in therapy, which we even call, parroting, or when we're holding clients accountable, that I think it gets lost in translation, that that's where therapists are almost giving you their opinion or giving you their thoughts on what they think about the situation or they think you should do within a situation. And this becomes a very gray area because sometimes you find yourself talking to someone where if you're not flat out saying, this was wrong what this person did to you, or like, hey, you know, this and this and this, these are signs of abuse, or whatever it is, I can go on and on and on. But sometimes a client doesn't get there on their own and the therapist has to spell it out. I think that this is a very, I don't want to call it uncomfy, but I think it's an uncomfy conversation because therapists are so scared of saying this and coming off as like, oh, I'm the type of therapist that's going to tell somebody what their life is or what to do with their life, because that's so not what I'm talking about at all. It's more about how do you deal with a situation where you can give all of the cues and all of the open-ended questions and all of the awareness and all of the education and the insight, and the client is just not getting that, like they're not getting to where they need to go because their answer to everything is like, I don't know, or they're just sitting in silence, or they're not really giving you a response that's making you realize like, hey, they're catching on to what I'm trying to get them to recognize. And Stephanie, I don't know if you've ever experienced this in sessions, but especially I've seen this a lot, especially in trauma, definitely in other places too, for sure. But especially when you've seen people experience certain elements of trauma and then talking you through certain experiences that they've been through that are horrendous, thinking it's completely normal. And you kind of being like, that's not okay. You know, like that's horrible that that happened. And they didn't even think about it in that light sometimes, or didn't realize. And this can be a really difficult space for both the clinician and the client.
Well, sometimes one of the things that we point out is the cognitive distortion of minimizing. And sometimes that's exactly what they're doing, where a client might say, I had this, and this done to me, but like, it's fine. Like, I'm fine. Like, I got through it or whatever.
Right.
And we might point out then and be like, actually, that sounds like you're minimizing. Actually, that's really not fine. And maybe it is something to explore a little bit more. And it's, of course, a very gentle push in that. And it's a little bit of a dance. And sometimes therapy is like that, in responding in ways that are gentle, yet also challenging. Because if we were just nodding, like we always talk about, we're not coddling, that's not the type of therapist we are. If we always are just nodding and reaffirming every single thing that might be problematic or hurting you in some way, that's not right. And I'm also not going to challenge everything about your life. That's not my job either. It's about, okay, this might be something that is actually impacting you when you might be thinking that it's not, and we can explore that in a safe place. And usually that happens. And also this, I'll give a simple example and why I believe that this is such a fine line, that we all know and can agree that self-harm is bad for you. And if I were to have a client that was just like, no, it's not bad, and in denial in every single which way I turn, that I can't get through to them, I at some point I have to say, and probably actually really, really quickly, I would say, this is not good for you. We have to figure that out. And that's an extreme example of this. But in other ways, and I know a lot of things that you're talking about are much more murky, but we still have to have that responsibility. And I believe that's the most ethical thing we can do.
Right. And so, you know, it's so hard. Like, even sometimes when you guys come in as clients and you're telling us your hopes and your goals and your dreams and what you want to look like as a person in terms of your character traits, or what you want to work on, what you want to overcome, what you want to recover from, your values, your beliefs, your thoughts, And I mean, especially in the kind of work that I do, and I think sometimes stuff with you as well, when your actions aren't aligning with that, we're gonna hold you accountable and call you out, because
Mhm.
that's part of helping you get to where you want to go. We're
Totally.
it's part, it's harsh sometimes, don't get me wrong, and we do try to do it with the care and sensitivity. Sometimes I use a lot of comedy when I'm doing work like that in my sessions, and I'll just be like, dude, like, come on, or like things like that, and we're always getting good
Right.
chuckles in there, but depending on what we're talking about, obviously. But my point is, this can show up in so many different ways, and I just
Mhm.
hope that clients can understand that sometimes this may feel like, what space did we just enter? First of all, if you're feeling weird about that, talk about it with your therapist, process it together.
Mhm.
Second of all, remember that part of us being your sounding board, being your safe space, being, the people that are trying to help guide you to where you want to go. We also have to pull you back when you're in the wrong direction and be like, hey, remember when you said you wanted to go right? I'm just letting you know that based off of what you're telling me, you're actually going left.
Yeah. Yeah. This is something that I reflect back to my clients in so many different circumstances where I say, okay, this is your values and goals. This is what you told me that you want. You want to go to college, yet you're in high school and you don't go to class. Is there something that, like, where's a gap there? Is that getting you to where you want to be? Or you want to be in a long-term relationship that's committed and monogamous, yet you are struggling to stay faithful to that person. Is there a gap there? Does one lead you to the next? Or let's say you have a desire that you want to have a baby one day, and I say, well, we do have to recognize that maybe you don't plan on it right now. However, you are struggling with an eating disorder and haven't had a menstrual cycle in 3 years. Like, what is it how do we close that gap? First off, I say, does this, what that you're doing now, lead you to your goals?
Hmm.
And usually they'll say no because they could see it. And then, okay, then what would? How do we change that gap? How do we
Mhm.
make that bridge? Because we can't have that disconnect in therapy. And that's a very appropriate thing to point out when it's cognitive dissonance, when you have two conflicting narratives in your mind or two conflicting things that just can't coexist together. You can't do that thing that we're talking about and still end up at your goal without making a change.
Or just that lack of experience or understanding. Like, I've had times where I've tried to help clients make that connection, and it's just, they're not making it. Like, I'll be like, do you
Mm-hmm.
see that gap? What gap? What? No, I don't know.
Mm-hmm.
And that space is so hard, because
Yeah.
our ideal session is you getting to these points on your own. And when we're recognizing, like, I have such a dumb example of this. And when I say dumb, I don't mean that this person's issue wasn't a real issue. I mean that I feel like, to the level of intensity that this can go, this is, a lighter example. But I worked with somebody once that spent the entirety of our sessions talking about depression and anxiety around their just like life situation, like the community that the person was living in, the people that were around them, how they detested everything about it and were so unhappy. They weren't happy with the schools in the area or the friends in the area or the, temples, the whole situation. And we're just talking
Mm-hmm.
about the same thing again and again and again and again. And I kept expressing, like, we're just putting band-aids on the wounds, because at the end of the day, like, something's got to give. Like, the
Right.
situation needs to change. And they were not coming to this conclusion on their own. And at one point, I literally just had to be like, we can keep talking about this until the end of time if you want. But I'm letting you know that as long as you're still living in this exact same situation and no changes are being made, chances are you're not going to feel any differently.
Mm-hmm.
Right. So that
Mm-hmm.
put me in a position of like, oh, so am I telling them to move? I'm telling them what to do with their life. No, I'm pointing out that they are bringing an array of issues that all bring us back to the exact same point, and bringing to that person's attention, hey, you don't want to feel this way. Well, we've established that this is the reason you're feeling this way. So if you continue with this thing, you're going to continue feeling this way. And that's where, I think sometimes on the end of the client, that could be misconstrued for, oh, well, my therapist told me to move today.
It's interesting because I think that sometimes a person might not like that another person's in therapy, and to sometimes that can be like if you're telling a parent that my therapist says that you're a toxic parent or something like that, and that's like literally not what we said, but all of a sudden it got construed as that, then you don't know like what that conversation is going outside. And then all of a sudden like they turn around and say, oh, my mom said that you're saying what I should do or should think. And that could be also a problematic relationship if you are getting some of that feedback. And perhaps, obviously, that's something to talk about with your therapist. I think that's so complicated. I can't even begin to dive into the dynamics that could create that. But sometimes it gets misconstrued when you're talking to someone else as to what actually happened in that therapy session.
Yes, which also brings me to, and we're not going to get too into this because we're going to get off topic, but a lot of the time the people around you will have comments about you going to therapy or your therapist, or will just put down anything your therapist says. Sometimes this could just be because they genuinely don't agree or don't like that person. And sometimes it can honestly be because they are, I hate saying this because I sound like such a mom, but it could be because they're jealous. You're doing the work on yourself. You're taking the time. You have that safe space you're going to. They're actively watching you work on yourself, potentially get better. Sometimes, unfortunately, there are friends that aren't necessarily real friends and, try to push you away from that, and keep that in mind, also who you're sharing your therapy details with or what you're talking about. Keep in mind, you also don't have to share it with anybody. But just that you might not always get the reactions that you're expecting or that you want when you share that.
Yeah, there could be so many reasons for it. It could be that maybe they're just from a different generation that has different beliefs about therapy or different culture, that maybe you are more, we talked about this before, that children of immigrants who were born here or raised in America might have this disconnect where therapy is something we could totally do and it's normal, and their parents might not understand that. There could be so many reasons that aren't in any way that they're bad people or anything like that. And with that being said, I think that we just want to put in a little bit of a disclaimer that it is also important to hear what your loved ones have to say about if they are saying things that maybe they have a concern about your therapist. And I think that this is same when it comes to like criticism or whatnot. We can take it in, fix it in our mind and understand it in our mind, throw away the unhelpful parts. And maybe the whole thing is unhelpful. It's like, oh, they just really don't understand. Or maybe they have a point and we need to kind of polish that in our brain to get down to the point as, is there a point here that I need to be taking, or do I just throw this out? And that's a really tough thing to navigate. But hopefully you have enough people in your life and you can talk to your therapist about it as well, that you can get a pretty well-rounded feedback and take that for what it is. It's complicated for sure. So with that being said, a couple more things that are important to address as to what therapy might look like. It's that we talked about you being challenged. There's a time and a place where we're challenging you. And there's a time and a place where we are there to offer comfort and validation. However, we want to keep moving the pace forward. And something that I know that as a therapist, I like to make sure that we are always finding meaning or purpose or something that we can move forward with. However, and this is something that we all as therapists need to know when, and that's part of our training and part of our experience as well, it's that sometimes whatever the situation you're bringing up, it just stinks. And we just need to be there and be a listening ear at that point and offer comfort and recognize that there's not anything I'm going to be able to say and do in this moment or for this situation right now that's going to be helpful or moving forward, or just it's going to get lost in the sauce here. So that's sometimes what sessions might look like depending on the situation. And so it can look so different, and it's not always about super big topics. Sometimes it might be something much smaller or much less impactful in your life. There's not really a one size fits all type of therapy. And I really wish that we could tell you all that this is all how it happens and this is how we can stick with it and you'll just know. But there's just so many different ways that it can look based on so many different factors. And let's talk about a little bit about what you might not expect in therapy.
Yeah. So first of all, and we talked about this in a previous episode, you really might not feel better immediately. Sometimes you might feel worse immediately, depending on how the session goes. Like I said, I literally have people who come in sometimes and they're just completely breaking down in front of me within 2 minutes. So they might feel a sense of relief a little bit, but they don't necessarily feel better. A lot of the time they come the next week and they're like, I'm emotionally exhausted. I brought up so much trauma, and I didn't even question them on it. They just said it. So, sometimes just knowing they're in therapy in itself is like the trigger to open Pandora's box. So depending on how that goes, you may feel heavier, you may feel deeper in thought, maybe mentally exhausted. You might feel exactly the same. And that could be frustrating for people. Like, I just had a therapy session. Like, why don't I feel better? Like, why don't I see change? And it's not going to happen in one therapy session, but it is one of the reasons that Steph and I love to give homework so much, because we do both very much believe in everyone leaving a session with something to work on, with something to think about, with something to utilize as a tool or as a skill. So hopefully you take something away from it. But even if you don't understand that, that is totally normal and that's totally okay and part of the therapeutic process, especially if you're going to a therapist that doesn't give homework. You may feel that a couple of times, especially in the beginning. And like I said, some sessions are very emotionally charged. Some sessions are very problem-solving focused. I also want to point out there, sometimes therapists will just talk to you about your day, about your week, and you're sitting there thinking, why are we schmoozing about my day or schmoozing about my week? Understand that a lot of the time this is part of the therapist's process, not only in you starting to let your guard down and open up a little bit more, getting to know you a little bit more, but this helps you recall certain instances that without going through the day or the week, you might not remember. I cannot even begin to tell you how many times I was like, okay, how was your week? Asking some various questions. And they're like, nothing really happened. And then I start putting them through the details of their week or their day. And they're like, oh my gosh, I forgot to floodgate. Me and my spouse got into the biggest fight. And we're just going on and on and that really opens up a lot of the work that we need to be talking about. That opens up, I remember someone was telling me the entire session that they were totally fine and nothing really happened, whatever. And in the last 10 minutes after they were taking me through their entire week, they just reminded to tell me that they self-harmed that week, or they just reminded to tell me that they purged or whatever, whatever horrendous behavior. And I'm just like, come on. But that's, by the way, why we ask you things that seem really simplistic and mundane. It really ends up helping you and helping us create those larger and deeper conversations. So don't get so in your head about, why aren't we covering the important things and the deep things? Why are we talking about this nonsense? Mm-hmm. Give your therapist a little bit of credit. There is a thought process behind what we're doing and why we're doing it and how we're asking you questions. So trust the process just a little bit. I know it can be hard and scary sometimes. Like I said before, there is that gray area of sometimes it feeling this way, but in reality, we will not be giving you advice or telling you what to do with your life. We will help point things out to you. We will help create a self-awareness and insight. We will educate you. We will bring things to your attention. If you're telling us again this and this and this and this is bothering me, and this and this and this and this is what I'm doing about it, we might be like, okay, 2 + 2 = 4. So what can we do about that, right? But we are not here to tell you what to do with your life. I've said this before. We have no authority. We don't know any secrets to the universe that you don't know. And so we're not in a position to tell you what to do with your life. It's your life. You're in the driver's seat. You're deciding where you want to go. We're just giving you a map. We're just helping you. Sorry, Steph, go ahead.
No, that's fine. So I was going to add that something that I notice a lot of my newer clients experiencing, it's that if I ask a question, that there's a very quick, I don't know. I find this a lot of my younger clients. And I talk and I say, I'm like, you don't have to know. And I don't expect you to know really, because that's why you're here. So sometimes what we need to do is I'm asking you to actually reflect on it right now. And it's okay if you don't know, because that's part of the process right now. We're trying to figure out what that I don't know is. So, because I think that a lot of clients, and I get it, especially people who are very uncomfortable being there, and especially teenagers when they are first starting, it's uncomfortable. You're giving your life story to an adult that you barely know. So it's very easy and quick to just be like, I don't know, just like out of nerves. Usually it's like, it's totally okay that you don't know. Why don't you take a moment and let's kind of explore this a little bit, and don't feel pressure that you have to know, and taking that pressure off and giving the ability to reflect. So mainly what I just want to say is that the therapy doesn't mean you know the answers, and it probably means that you don't know the answers if you're there. And that's what the questions that we ask and the way that we ask them and trying to work together, that is a part of the process as well. So don't feel pressure that you have to know the answers, or that it's like, it's not a teacher student thing. And I always say that to my younger clients, like, I'm not your teacher. I'm not grading you or anything like that.
Right.
So it's totally okay if you don't know here.
Oh, yeah. And the last thing I really just wanted to add, which is very similar to the I don't know, is even though it feels really good to have these light bulb aha moments in therapy, and they do happen, don't feel like you didn't have a successful session if they don't happen, or if they don't happen each time, or that if you didn't have one today, that therapy isn't working for you. I know people get really excited waiting for this moment of clarity, or this moment where everything changed, the moment where everything clicked, but you're not always going to have those moments in therapy, and that's okay.
And on the other side too, from a therapist perspective, sometimes I might think that I said something like somewhat profound and it doesn't actually like land or get anywhere. And then there's some things that my clients will bring up at a later date and just explaining something that I said that seems so just like fly, like,
oh my
just,
gosh, yes.
and I'm like, it was just like such a random comment that I made or something that I said or did. And they'll be like, yeah, I was just thinking about that. And I'm just like, I totally forgot that happened, and that made a big impact. And it's not, everything's not making a big, like an impact that feels that way every single day. But you've also had this experience before multiple times, I'm sure.
Yeah. So it's actually so funny and such a valid example, because how many times I've had that experience, I can't even count.
It's so funny. But with that being said, progress is usually subtle. It's not flashy, and that doesn't mean it's any less real. In fact, that's how the process usually looks. And what I would encourage anyone who's not really sure about whether or not therapy is working for them, or not really sure what it's supposed to look like, reframe what a successful session looks like. So it's not always going to feel like this deep emotional catharsis or anything like that. Doesn't mean it wasn't helpful. And sometimes the most important shifts really show up later or can happen over time. And it's like a puzzle piece, as opposed to just every session isn't the puzzle. Most sessions actually are just pieces of the puzzle. So you're putting it together, and that is really where recovery is. So it might not feel complete until that point where it's complete. And if you are ever unsure of anything, or you feel disappointed about the process or not sure about whether or not therapy is working, I cannot stress this enough. Talk to your therapist about it. I say this to my clients all the time, and Rachel, I'm sure you do as well, that if anything you feel is not working for you, or you have any type of feelings about the process, I will not be offended. Please, please bring it up to me, because I've said it before and I'll say it again. Some things that work with one client might not work for you, and some ways that I might approach things might not work for you, or I could either explain why I did it, because sometimes it's just actually aggravating an unhealthy part of you, and it's actually important that this transpired the way that it does, and I can explain that to you. Or I can adjust, or if it's really just a style that doesn't work for you, I can refer out to a different therapist. So a good therapist will be receptive of any concerns that you have and can help walk you through that process. Sometimes, especially with the more perfectionist type of clients, there is this desire to perform and be the perfect client and all of that. Let it go. If that's something that you feel, you do not have to perform in session. So if you are feeling as though you are performing, talk to your therapist about it, and it's okay. And it doesn't mean that there's something wrong with you or that the therapist is going to think anything different about you. Just being honest about that tendency that you have and letting that go can be really powerful. And discomfort is a part of the process. So trust that and don't take that to mean that it's not working. So some questions that I would encourage you to ask yourself is, from one session to another that didn't really feel that it was cathartic or what you had hoped it was, ask yourself, do you feel safe and supported in the therapy space? Are you starting to notice your thoughts or feelings in a new way? Because that's also a subtle sign of progress and something that often gets overlooked. And do you feel like the therapist is helping you move toward your goals, even if that's at a really slow pace? So take some time if you are struggling with not knowing if therapy is working, not knowing what the therapy process is looking like. If you answer those questions, you could probably get a pretty good idea as to if you're doing it right.
So let's go through some key takeaways. So number one, therapy is a process, not a quick fix. You likely won't feel cured after one session, and that is okay. You don't have to perform in therapy. There's no wrong or right answer to things. There's no right or wrong way to show up. There's no right or wrong way to feel. We're not here to judge you. We're just here to be there for you. The first session is about building a foundation, getting to know the therapist, the client, seeing if this is a good fit for the both of you. It's normal to spend time sharing background information and discussing your goals. Most sessions involve reflection, processing, and gradual insight, not dramatic, crazy light bulb breakthroughs. And not every session will feel super productive, but that does not mean that it wasn't valuable. And that doesn't mean that there weren't productive moments within that session. It's also okay to feel worse before feeling better. It's okay to walk out of sessions feeling really emotionally exhausted, feeling worse than you did walking into it. It can sometimes be a sign that there is much deeper work and healing happening for you, and that's actually a good sign. But really what matters the most is you feeling safe, heard, validated to a degree. But, this should be the space where you can be you unapologetically, and your therapy session should be like your verbal journal. And that's, if it's not feeling that way, you deserve to feel that way. So find a therapist that creates that space for you where, you guys fit. And just a tip, especially if you've never been in therapy, and even if you've never been in therapy, I know a lot of people are already aware of this, but just something to bring into the therapeutic space with you, aside from an open mind and honesty, is a journal. Bring a notebook, bring a journal. There's a lot to talk about, a lot to process, a lot of things that your therapist will ask you to reflect on, questions that the therapist might ask you that maybe you don't have the answer for in that moment, but you want to think about throughout the week, homework, whatever it is. And so it's really, really helpful and important that you have something with you, then you could jot things down on. So just, if you're about to start a therapy journey, make it a little gift to yourself for starting that process. Get a cute, fun journal, decorate a brand new journal, whatever your style is, that kind of gets you excited about truly doing that work and making sure that you bring that into your sessions so that you have that available to you if you need it, because trust me, you will need it.
I'm so grateful that you brought that up, because that is such an awesome tip, because I can't tell you how many times I've had clients that were worried and did forget things from one session to the next. And they're like, because they forgot their notebook. This has happened multiple times where they brought a book, and then the one time they didn't, and they're like, oh my gosh, I was racking my brain all week. There was something that we talked about that I couldn't remember. And we have to backtrack to try to remember what it was that exactly they were looking for to get it back in their journal. So a journal is an awesome, awesome suggestion. So on to our listeners' question. And you guys send in your listener questions to us over at Instagram at Coffee and Counseling Podcast, or email to coffeeandcounselingpodcast@gmail.com for a chance for your question to be featured in one of our next sessions. So today, our listener's question is it normal to feel worse after a therapy session? And I think that we did a pretty good job at covering that is absolutely something that can be normal. And therapy is not going to feel as though you are walking out to sunshine and rainbows. Sometimes it could, but oftentimes it's really not. Oftentimes it might be where you're more in deep thought, or in a moment where you really put out a lot and you might feel emotionally exhausted. And sometimes you might feel as though you open up a door that you weren't ready to, or you didn't feel like you were ready to, but you knew you had to. And that can leave you feeling vulnerable. There's not one right feeling. And you can have multiple feelings too, maybe even conflicting feelings after leaving a therapy session. And it's important just to be honest with your therapist about it. Make sure that you're safe, of course, if you are feeling worse after therapy. If you do struggle with something like self-harm or whatever, that is important to discuss with your therapist to make sure that you have skills in place and tools to prevent that, and to make sure that you are safe. But all in all, it is normal that sometimes you can feel worse after a therapy session. So we are really grateful that you joined us today. We are hoping that you will reflect on this question. What do you think you've been expecting from therapy, and where do you think that expectation came from? So we're encouraging you to reflect on these questions. Was it based on something you saw in a movie, a friend's experience, a hope for quick relief? If you've been to therapy, consider journaling about what has surprised you the most so far in your therapy journey. And if you haven't, jot down what you hope for and what you are hoping to get from it, and what might be getting in the way of you seeking out therapy, because sometimes you might not go to therapy based on your expectations of it. So again, you could send any feedback or topic suggestions, thoughts, listeners' questions to us over at Instagram at Coffee and Counseling Podcast. And we hope you're following us over there. Or you can email us at coffeeandcounselingpodcast@gmail.com. Everything will be linked in the show notes, and we hope you join us again next Tuesday.
Have a great week, guys. Bye. Thank you.
Thank you so much for being with us today. Please follow our Instagram at Coffee and Counseling Podcast, and send any questions you have about any topic to us via direct message for a chance for your question to be featured in one of our next sessions. You can also email us your questions or topic suggestions at coffeeandcounselingpodcast@gmail.com. Make sure to check out some of our other sessions available to you right now. Once you drink up all of those and your coffee, come back next Tuesday for our next session.
The information shared in this podcast is for educational and informational purposes only and does not constitute therapy or mental health advice. Listening to this podcast does not establish a therapeutic relationship between you and the hosts. If you are in need of support, we encourage you to seek help from a qualified mental health professional. This podcast is not a substitute for individualized care. We do offer individualized therapy. If you're interested in individual therapy with one of us, please visit our practice website and send us an email to set up a free consultation call. All of the links and our contact info will be in the show notes.